We're going to finish up the pulmonary system and discuss some pediatric pulmonary problems. As usual, slightly different than those in adults, although they can obviously have some of the same things, pneumonia, bronchitis, and the like. So spend a little bit more time with COPD. COPD is it's pretty common among people my age who smoked their whole lives. Emphysema and chronic bronchitis in the United States are almost entirely caused by years of cigarette smoking. Occasionally you'll find somebody that got it from a work environment where they breathed a lot of dust or fumes or something, but it's pretty much a smoker's disease. And it comes in a couple of different types. These are obstructive lung disease, chronic obstructive pulmonary disease. And what it means is that you can't breathe out. Your lung tissue is so damaged that all of those stretchy, fibrous rubber bands that are helping you breathe out, when you pull your lungs open, you have recoil, elastic recoil, that helps you breathe out. Those rubber bands get all broken. The airways get so soft that when you try to push it out, they collapse and no air will go through them. And so it obstructs air getting out of your lungs. So dyspnea, wheezing, asthma is considered a COPD, an obstructive lung disease. It's not exactly like the other guys, but it often comes along with emphysema and bronchitis, chronic bronchitis, because it's an inflammatory problem, and these cause additional inflammation. So people with these often have asthma as well. Although kids get asthma, I had asthma as a kid and it had nothing to do with COPD. Type 1 COPD is emphysema and type 2 is chronic bronchitis. Both are obstructive diseases and we'll talk about them some more. First of all, we have asthma, and it can be caused by, well, it is an inflammation of the small airways. The bronchioles that are muscular will squeeze shut and not let air go in or out. It's worse when you're breathing out, because if they're squeezed almost shut and you push hard to get the air out, you smash them and they close the rest of the way. So asthmatics will wheeze both in and out, but they have a harder time blowing out than sucking the air in. And so what it really is a good old inflammatory response. Mast cells, you have, your histamines and other compounds that are released with inflammation, IgE production, which turns on more mast cells and gives you more histamine and the like. And you shut down your airways. They constrict so much that it's really difficult for air to go through. Ultimately, if you have it long enough, it becomes a chronic problem, and it causes more like a chronic bronchitis type of situation, causing damage to the membranes and so forth. Childhood asthma, except for kids who have it really bad, isn't really that way. You have constriction when you breathe in something that you're a little bit allergic to, even cold air. I used to get my asthma attacks at night if I was in a pillow fight with somebody or something, because that would breathing the cool air in more rapidly would cause me to have an asthma attack. Those would typically go away in an hour. Chronic inflammation of the airways, hyper-responsiveness of the airways to whatever. Cold is one. Real dry air will do it. Oral corticoids, steroids that cause a decrease in inflammation in that area. Beta agonists, you remember the beta 2 receptors are the ones, the sympathetic receptors that dilate your lungs during fight or flight, during exercise. So if you can stimulate those beta receptors, those same ones, it dilates your lungs. And true COPD, it's a couple of problems you have here. One is that you have, you start off with damage to the epithelium, which has all the cilia, the ciliated columnar cells. The cilia are moving the mucus out with all of the bacteria and crud that you breathe in all the time and keeping it out of your lungs. It starts off with, early on, smoking deactivates and ultimately kills the cilia, so you can't move the crap out. And so you get the smoker's cough. It's almost like having cystic fibrosis. The thick, heavy mucus is in there, and it's really hard to get it to move out. Well, that gives a beautiful living place for bacteria, and it starts causing an inflammation from pollens and bacteria and stuff in there. Inflammatory response causes a lot of histamine, a lot of vasomediators and stuff. It causes a lot of immune response that ultimately damages the walls of those airways further. With type 1 COPD, you damage so many elastic tissues and the alveoli that have that surface tension that helps you breathe out as well because it's pulling inward. So many of them are gone that you just lose about a third of your lung capacity. There's no lung tissue there anymore. They're big holes. The term emphysema actually means too much air. And so if you have pulmonary emphysema, you have big holes in your lungs that don't have any alveoli in them and no elastic tissue either. It just sort of melts away, and your lungs are super full of air and you can't blow it out. So your lungs are full of stale air all the time that you can't move very well. With chronic bronchitis, you actually always have an infection because you can't get rid of the bacteria that are in there. And the infection causes the true inflammatory response, causes a lot of extra mucus to be produced. The airways get real soft and mushy, and they halfway fill with mucus, and when you try to blow out, they just collapse and just block off the air, so no air can move out of those alveoli. So one is truly a damage of the lung tissue or a dissolution of the lung tissue. The other is kind of a stretching out and sagging of airways and filling up with mucus. It gives you kind of two different problems, but both of them mean that you can't breathe out very well. Tobacco smoker, air pollution, inflammation, the full inflammatory response, the breakdown of the fibrous tissue, breakdown of the alveoli, airway obstruction, air trapping. You can get a telangiectasia. Remember, that means you can't inflate an alveolus, because if it gets completely blocked off with a mucus plug, you can't move air in and out at all of that part of the lung, and those you'll absorb some of that air that's in there, and those alveoli will sort of collapse in there. Ultimately, low oxygen in the blood. Cor Pulmonale, which we'll talk about, it's where you get hypertension in the lungs because you can't move the fluid through. It puts stress on the right side of the heart that's trying to push the blood in there, and you get right side heart failure because of the lung disease. Remember, with COPD, it's hard to breathe out. When you suck in, you actually kind of open the airways, and the air can squeeze past the mucus plugs. You try to breathe out, and it smashes them, and no air can come out. So emphysema, type 1, COPD, permanent enlargement of the airways, dissolution of some of the lung tissue. People can't breathe out to get rid of the stale air, so they keep trying to breathe in to get more fresh air in there. Ultimately, they wind up with huge, really tall lung spaces. You can see the lungs here are going all the way up into the person's neck. Way up high, way down low. The diaphragm is way down here, and there's just no elastic recoil to keep the lungs constricted to their normal size. Huge residual volume. Remember, that's the air you can't breathe out. So residual volume makes up most of your lung capacity. And your vital capacity, of course, which is the part you can move, decreases. Chronic bronchitis is type 2. Constant inflammation because of the permanent infection. Lot of mucus production, blocking off airways, and really softening of the walls of the airways so that they collapse too easily. Mucus is thick because you're not moving it out. It has a chance to kind of dry and harden in there. They call these guys the pink puffers. Not a very nice thing to, but they're, you know, the general description is what happens. These guys are actually keeping enough oxygen in their blood by working hard. And so it keeps them pinked up, where they call these the blue bloaters. You can't push air past a mucus plug, so it doesn't, the puffing doesn't work with chronic bronchitis. Instead, they sort of turn blue because they are getting low on oxygen and high on carbon dioxide. And they bloat because the return of the blood to the right side of the heart is blocked by all of this pulmonary hypertension, and their face kind of swells and their jugular veins stick out on the side of their necks. Right now, there's no good treatment for COPD. You can open the airways better. You can suppress some of the goo that's being made, but you can't reverse it. We don't have a reversal process right now. Sometimes they'll remove part of the worst part of the lung and stitch the rest together to try to reestablish a better volume and also a little bit of reattaching the rubber bands kind of thing. But serious COPD is serious, and it's a chronic disease. You see people with wheeling around their oxygen carts with them. Now, pneumonias are acute infections. I mean, you catch pneumonia. You can catch a walking pneumonia or community-acquired pneumonia by being around somebody that has it or having it in the air. A couple of friends of mine just went somewhere and they came back and both of them had pneumonia and they have no idea where they got it from. Usually that type of pneumonia is not life-threatening, although it can be. Often it's usually a viral pneumonia that will go away on its own. Sometimes it's a walking pneumonia that is a mycoplasma, which is a kind of a different kind of bacteria, and they call it walking pneumonia because people still walk around and go to work even though they feel terrible. Hospital-acquired pneumonias tend to be more serious, although I hate to say that because I had a friend who died of a community-acquired pneumonia. He didn't go to the hospital first. But anyway, it's generally a different kind and more immediately life-threatening, the hospital-acquired pneumonias. So you breathe in strep bacterium. It takes over, it starts eating away in there and causing a huge inflammatory response that causes a lot of fluid to leak into the alveoli. And the white areas And the heart is over here, but this white area, it's all supposed to look like this. It should look clear with little tiny bits of fibrous tissue in there. And if you have a big white area, that's a lobe. The lower right lobe, might be what's infected here. And that's where the pneumonia is. Viral pneumonias sometimes become bacterial pneumonias. Viral pneumonias usually resolve on their own. Our body they take the time to make the antibody. It attaches to the virus, our immune system attacks it, and we get over it. It takes a while. That's why pneumonia vaccinations for people over 60 are recommended, because you might die before your body can recover. Bacterial pneumonias generally require antibiotics to get rid of them. But at least you have antibiotics. The antivirals are not generally as effective as antibiotics, so what you have to do is hope your body can get rid of the viral pneumonia, vaccinate against it if you can, and take antibiotics if you get bacterial pneumonias. Tuberculosis is a bacterial infection. It's not widespread in the U.S., but it's still fairly widespread in tropical type areas. If you come back from South America or Africa or someplace and you're going to be a nurse, you have to be tested for tuberculosis. And they put a little bit of the, killed virus on your skin, and you see if you infect or not. See if you react to it. But anyway, the bacillus is encapsulated by your own tissues in these tubercles. A tubercle is like a round fibrous ball in your lung that has shut off some of the bacteria. Your body's trying to defend against them. Ultimately, it kills you. Your lungs become so fibrotic that you can't move your lungs anymore. The skin test is what's the best way to find out if you have been exposed. And then there are treatments. There are antibacterials and things that you can take. A pulmonary embolism or embolus, remember an embolus is a thrombus or blob of something from somewhere that came from somewhere else and lodges somewhere. As things come back in the venous system, it's easy for them to make it all the way back to your heart because the blood vessels keep bigger and bigger on your way to your heart. When it leaves the heart and goes up in the pulmonary arteries, the arteries are getting smaller and smaller and smaller until you reach the capillary beds. So a blob of fat, an air bubble, a piece of broken off plaque, or a thrombus that broke loose. Deep vein thrombosis is one of the main causes of pulmonary embolus because they break loose and manage to make it into your lungs. And when they do, depending on how big an area of the lung they block off, it can be lethal, or it can just make you feel bad and out of breath. It depends on how much of the lung got blocked off. 3 likely causes: venous stasis, sitting too much. People get deep vein thrombosis who are in wheelchairs all the time, or people who've had surgeries and refuse to get out of bed and walk around, or whatever. If you have a hypercoagulability, if you have a condition that causes you to make clots more often, that's a bad thing. And surgical procedures. So people who've had leg surgery especially, even though it doesn't feel good, they want you to get up and walk around, keep that blood moving in the legs. Pulmonary embolism, here it's coming from a deep vein thrombosis, working its way up, and coming out and blocking off major blood vessels to this lung. This lung is going to be almost useless. Now, you can survive on one lung, so it just depends on how much gets blocked. But pulmonary emboli are life-threatening. They can be broken up with things like TPA. Pulmonary hypertension is quite common in people with heart failure. Some people have pulmonary hypertension, it's idiopathic. There's no particular reason that you can address to make it go away. If you have left side heart failure and all this blood is being pushed into the lungs but it can't get out because the left side isn't taking blood very well, then the backup of pressure builds up pulmonary hypertension. If you can fix the problem that's causing the left side heart failure before it gets too bad, you can resolve it at least somewhat. So idiopathic, otherwise normal lungs, or respiratory disease, high altitude sickness. When you go up really high and the lungs have so little oxygen in them, the blood vessels all constrict, and now the pressure goes up because you're ramming your full cardiac output into those lungs, but you've made the blood vessels half the size because they've constricted, and the pressure goes up so high, you start leaking fluid into the alveoli. COPD of some sort. Chronic low oxygen and high carbon dioxide with acidosis. Pulmonary artery constriction. If you can solve it, you can resolve it. But beyond a certain point, the damage becomes at least somewhat irreversible. It damages the tissue, it damages the blood vessels, and you start leaking fluid into the alveoli. Once you do that and have pulmonary edema to go along with this pulmonary hypertension, the oxygen to your heart is limited because you're not oxygenating your blood very well, so your heart starts to fail worse because it's hypoxic itself. Cor Pulmonale, the hypertrophy of the right ventricle because the pressure in here is higher than the right side can handle. Right heart failure. Here's what I've been talking about, Cor Pulmonale. It's the heart disease that's caused by lung disease, not the other way around. If you have left side heart failure, it will cause lung problems because the pressure goes up so high in there. But if you have lung problems, it will cause right side heart failure because the right side is not used to pushing so hard, and it will hypertrophy and ultimately fail. Cancer, lung cancer, throat cancer, lip cancer, oral cancers. Lip cancers are generally treatable if you treat them early enough. This exophytic outward growth of a cancer, that would be pretty obvious. This would not necessarily be obvious as a cancer, kind of like the tiny little cancer I had on my cheek. Generally, they're, a squamous cell or basal cell and can be removed. They may leave you scarred if you wait too long. Throat cancer is, usually a cancer right in the area of the vocal cords. Now, you can have any part of your mouth or the back of your throat become cancerous, But these are delicate tissues that are damaged by years of smoking, especially cigar or pipe or chewing tobacco, where even if you try to spit out most of the tobacco juice, you wind up swallowing a little bit all the time. It gives those constant inflammation and carcinogenic effects to those tissues, and the vocal cords themselves become cancerous. You remove them, and from then on you have to plug it up if you want to try to talk, and you have to use an artificial speech maker that sounds like a robot. Laryngectomy, a removal of the voice box, basically. And lung cancer is still a really bad one for us. It's not one we've done a great job of learning how to treat. Most lung cancer is related to cigarettes, although about 1 in 20 people that get it never smoked. I had a friend who was a coach of University of Wisconsin, and he was, I don't know, 35 or something like that. He just got lung cancer and died. And a big problem is that you don't know you have it until it's pretty advanced. You know, stage 1, 2, 3, 4. If you can find it at stage 1, that's fine, but there aren't any symptoms yet. And so unless you're in there for some other kind of reason to have a chest x-ray, you're probably going to be in stage 3 or even stage 4 before you go to the doctor. Smoking, cancers of the larynx, the mouth, esophagus, and urinary bladder in addition. But lung cancer is still a huge killer. 174,000 people in the U.S. diagnosed every year with lung cancer. And even if you find it early, only half of them live for 5 years. So it's not a good cancer to have. Only 1% survive if they are discovered at stage 4. It's that virulent. Early signs are very mild. A cough, it seems like kind of a allergy cough or acute bronchitis. Well, I must have had a cold, and it just went down into my lungs, and you cough, and 6 months goes by and you're still coughing. Finally get it checked out, and it's already progressed. You'll hear them talk of small cell cancer and non-small cell cancer. Well, it's either small cell cancer or it's one of the others. Small cell cancer simply causes that because the cancer cells themselves are smaller than all the normal cells around them. It's slightly different and treated slightly differently than the other cancers. Non-small cell cancers can be just cells that are regular size, or it can be large cell cancers where all the cancer cells are larger than the cells around them. So this will help decide, because of the type of cancer cell, it will help decide some of the treatment options. Non-small cell squamous cell carcinoma, so the lining of the airways. Adenocarcinoma grows and looks like a glandular tumor. Lung cancers look like thick spider webs, or if you get one that's big enough, it has that crab-like appearance. It looks a little bit like a pneumonia, except it doesn't block off a whole lobe. It has a central focus and kind of radiates out from there. You have to be a pretty good radiologist to pick it up pretty quickly, the difference between the different lung diseases on imaging. So that takes us through the end of the adult or everybody cancers. As we'll see, kids can get some of these too. Very few kids get lung cancer. They're mostly caused by smoking, and kids don't smoke by the time they're 5, usually. They can get cancers from secondhand smoke, but it usually takes a number of years for smoking to cause lung cancer. So here's some different things that happen to kids in their pulmonary systems. Upper respiratory airway infections are very common in kids. They're always coughing and sneezing. Croup is a very common upper respiratory airway in kids. You cough and it sounds like you're barking. Ho, ho, ho. Laryngotracheobronchitis. It means an inflammation of the bronchi, the trachea, and the larynx. Usually an influenza, flu-type virus that has gotten in there. Spasmodic croup. It might just suddenly happen. Really young ones, usually it comes along with some other kind of illness too. And you can have a bacterial infection of the larynx and trachea, which can cause constriction and actually be life-threatening. If the airways stay open so you can breathe, you can kind of wait it out. If you start to swell the airways shut, you can't. So in young kids, croup usually starts after a real upper respiratory, runny nose, kind of sneezing, sore throat thing. You start getting a hoarse-sounding voice and wheezing on inspiration. So stridor, remember, is wheezing. Seal-like barking cough. And usually goes away in a couple of days. It's viral. You make up the antibodies, you start attacking it, you get rid of it normally. Inflammation, upper airway obstruction is the dangerous part of it. Collapse of the upper airway. So if it gets bad enough, there's people die of coughs. And what can come along with croup, or can come from something else too, a bad strep throat or something, you can have epiglottitis. Remember, the epiglottis is the flap that closes off the airways so you can swallow and closes off the esophagus so you can breathe. If that swells too much, it closes off the airways permanently and you can't breathe at all. And it can be lethal. Flu virus, possibly. Kids who have their flu vaccines are only, like 80 to 90% less likely to get acute epiglottitis. And this, since it can kill you, it's really kind of a bad thing. Here's the epiglottis the way it's supposed to look, and here it is when it's swollen shut. In this case, an airway tube has been inserted so that the kid can breathe until they can get rid of the inflammation. Emergency airway antibiotics if it's a bacterial infection. Tonsillitis is an upper respiratory inflammation that lots and lots of kids get. Strep, it's a strep throat. I got tonsillitis about 8 times when I was a kid, and my doctor was actually ahead of the time. He kept giving me antibiotics to get rid of it instead of doing a tonsillectomy. Finally, we gave up and had my tonsils out. And after that, I still got strep throat, but I couldn't get tonsillitis anymore. I had quite a few throat infections when I was a kid. Mononucleosis is a causer also. That's viral. Can be obstructive. If they swell enough, mine were more swollen than this. I mean, they swole out until there was just a narrow opening in the back of my throat. And of course, kids breathe in stuff. So do adults. Now, you can breathe in a piece of chicken or something and block your airway and die within 3 minutes if somebody doesn't do Heimlich maneuver on you. This person has breathed in nail clippers. If you look closely, you'll see it's kind of upside down. That's a nail clipper. I'm not sure exactly how that happened, but, you know, things happen. Things happen. Wheezing, gagging. If the person is making noises that are just kind of squealing noises and no air is moving decently, then they're in trouble. If they're coughing, they're probably not in trouble. It may feel terrible and feel like they're strangling, but if they're actually coughing, there's still an airway that's moving. Foreign bodies removed by bronchoscopy, they're going to have to feed a tool in there and grab that and pull it out. And abdominal thrusts, which are what the Heimlich maneuver is called these days. I met Dr. Heimlich. He was on the board of a foundation that I dealt with for a while. And, you know, he developed the Heimlich maneuver. He even had to use it in the retirement home where he was when he was in his 80s. And he said he'd never actually had to use it on anybody until that day. And he managed to use it on some lady in his place that was choking and saved her that way. Obstructive sleep apnea is something that happens in adults but also can happen in kids, especially if your tonsils or adenoids, which are tonsillar type tissues in the upper part of the back of your throat, swell too much, and when you relax during sleep, they collapse together and you can't get the air to move, and you suddenly and open them up enough to breathe for a little while, and then you relax and they collapse again. So sleep apnea, you breathe for a while and then you stop for a while. You can have a tonsillectomy or take out the adenoids. Continuous positive airway pressure is used for anybody with sleep apnea. It blows air in under pressure and opens everything up so the air can move more easily. Respiratory distress syndrome of the newborn. Well, you can have respiratory distress in adults for a variety of reasons. You can have pneumonia, you can have a severe asthma attack, severe allergy attack, anaphylactic reaction to a bee sting or something. But in the newborn, generally speaking, they have not made their type 2 cells yet, or they haven't matured enough to make pulmonary surfactant. And the surfactant breaks that surface tension and allows you to inhale. And these little tiny lungs with very weak inspiratory muscles simply can't suck the air in against this extra resistance because of the lack of pulmonary surfactant. So they put them on a ventilator, they put them on a respirator, they put nebulized surfactant in there to loosen it up. It's especially common in premature infants. Very few premature infants, if they're very premature, can breathe on their own. They have to be assisted for a little while until they develop this surfactant. If not, it causes atelectasis. The airways can't be inflated, so they close down enough to block off, and the air is absorbed, and those alveoli collapse, and it can lead to respiratory failure and death. Symptoms: breathing really fast, making noises when you try to breathe, because nasal flaring, anything trying to get more air in. Try not to allow them to be preemies if you can. A good friend of my wife's sister has been trying to prevent a premature birth. She kept showing signs she was going to go into labor, and she was just lying in bed doing everything she could to stop it, and she had the baby anyway. And it's a month premature. It's really premature. Mechanical ventilation, surfactant. Here's the overall flow chart from being preemie, not enough surfactant, atelectasis, the decrease of oxygenation of the blood, pulmonary hypoperfusion, not enough blood going through the lungs, respiratory acidosis by not breathing enough, and finally respiratory failure. And that's all really upper respiratory. The disorders of the lower respiratory system, well, RDS is the whole lungs, so yeah, I shouldn't say that. But disorders that are specific to the lower respiratory system are like bronchitis. You can have acute bronchitis. A kid can have pneumonia. It's way down in the alveoli and in the lower tubes. But some kids will have a problem from the moment they're born because they have not developed their lungs properly. So dysplasia means they didn't grow right to begin with. You generally won't find that in a 50-year-old. You know, their lungs developed enough that they lived that long. Now they're having problems that come from environmental factors and stuff over the years. But a kid can be born with lungs that don't work well enough. Acute respiratory disease in the neonatal period can be a cause. So when they're brand new and they have RDS and they're fighting it and they have a ventilator which is hard on their lungs, they can damage the lungs to the point that they don't mature properly. Premature birth, immature lungs, ventilatory support at birth, so they don't want to leave the ventilators on any longer than they have to. Not enough oxygen in the blood, too much CO2, very difficult breathing. But once they got good at developing a surfactant that they could actually spray into the lungs, that's helped a lot. A lot of kids can breathe with that and not have to go on a respirator. Respiratory infections include bronchiolitis, which is more common in kids than it is in older people. It's a virus. We're going to see this respiratory syncytial virus in several different respiratory type diseases. Bronchiolitis means an inflammation of those smallest airways, the muscular ones, causing them to close off, kind of like asthma, like an asthma attack. A big reason why really young kids tend to be hospitalized. Runny nose, very tight cough, wheezing. Pneumonia, both bacterial and viral, can happen in kids, especially kids that have been in the hospital a lot. It's easy to catch hospital-acquired diseases like pneumonias, MRSA, and the like. Strep or staph bacterial infections. The strep one is the most likely community-acquired one that you get from your daycare center. Or, again, sometimes people get community-acquired pneumonias who haven't been around anybody at all. They just inhale it, the bacteria, and pick it up. And it's not that uncommon for a viral respiratory problem, whether it's a pneumonia or a viral bronchitis, to cause enough damage and lowering of the immune system that it lets the bacteria catch on that might have been kept at bay. Viral pneumonias are usually this RSV virus, some flu viruses and things too. And here's our walking pneumonia. Kids get it pretty commonly. It's a very common community-acquired type pneumonia. Kids will get it. They'll be pretty sick. Adults can get it. They'll be pretty sick. Sometimes they think they just have bronchitis. Usually it will go away on its own anyway. But it's a mycoplasma, which is a slightly different atypical bacterium that is responsible for this walking pneumonia. Kids breathe in a lot of stuff. They are always putting stuff in their mouth. They swallow it, they breathe it in, they choke on it. And breathing in substances into the lungs can cause them to inflame and become, pneumonitis is not pneumonia, it's an inflammation of the lungs. So it feels like pneumonia. So if you breathe in water, especially if it has any bacteria or anything in it at all, if you suck in your own saliva, it's not sterile. If you vomit and aspirate some of your vomitus, it's very harmful. It has bacteria, it has acids in it. It's really an inflammatory type liquid. It's why they don't let you eat anything for 12 hours before you have surgery. Meconium, which is the poop, basically baby poop, while they're still in utero. If some of that they're not breathing, but if some of that manages to get into their airways, it can cause a pneumonitis while they're still in utero or right when they're born. Bronchiolitis obliterans. Remember, we had another obliterans. It was an angio problem in young men who smoke, and some of their blood vessels would just block up and you basically be obliterated. So this is an obstruction of the respiratory bronchioles after a really intense or kind of chronic inflammation that will cause the bronchioles to try to heal themselves and wind up fibrosing themselves so that they become blocked off or can't stretch and open to let air go in and out. Severe viral pulmonary infection may come first. The inflammation causes the fibrosis. Fast breathing, hard to breathe, cough, extra sputum production from all the inflammation, wheezing, stridor. And kids get asthma all the time. It is a hyperreactivity to something. Young lungs aren't used to anything. They're not used to real hot. They're not used to real cold. They haven't been exposed to allergens yet. And so it's a hypersensitivity reaction. You can have an asthma attack just come on really fast. Most prevalent common childhood disease, chronic childhood disease. I had it probably for, I don't remember if I had problems with it when I was 2, but I know that by the time I knew anything about it, 3, 4, 5, up until I was probably 12 or 13, I would have asthma attacks. And mine were not severe. I didn't have to go to the hospital, but it was real uncomfortable and scary. Genetic susceptibility, environmental factors, dust mites, cat dander, tobacco smoke, and cold, dry air. Here we have our antigens entering, setting off the IgE and release, degranulation of the mast cells and the production of histamines, which causes a constriction of airways, increase in mucus secretion. And if it's if you have a lot of problems for a lot of years, you damage the endothelium. And it can become a lifetime of at least somewhat compromised pulmonary function. And acute respiratory distress syndrome just means you can't breathe right now. It can happen to adults if they breathe in something that causes their airways to squeeze. If you get stung by a bee and you have an anaphylactic reaction. If you breathe in toxic fumes, if you have a bad allergic attack, if you have pneumonia and it suddenly causes such a response to the inflammation that it causes the airways to close, near drowning. Sepsis will do it. If you go septic and all of your epithelial linings of your blood vessels and your airways aren't working properly, people can die of respiratory failure if they're septic. Inflammation, fluid in the air spaces, and therefore atelectasia, alveolar collapse. And kids can be born with cystic fibrosis. It is a autosomal recessive disease, genetic disease, so you have to get it from both parents. Kids still get it because both parents they're carriers. It's recessive, so they don't know they had it. Their parents weren't sick either. One of them was a carrier and gave them a recessive gene. It can go on for a few generations before somebody marries somebody that also is a carrier, and then they have a kid that has 2 of these recessive genes, and suddenly that kid has cystic fibrosis. And I've never been checked for cystic fibrosis as a recessive gene. I don't think I do, because nobody in my family has ever had it, but it doesn't mean for sure that I don't have it. So what happens is you don't have the gene that makes the cystic fibrosis transporter. It's a chloride transporter in the airways that moves chloride ions. Sodium ions follow them because they're attracted to them. And water moves by osmosis, and it keeps the mucus in your airways soft and liquid so that your cilia can move them out. Without that, the mucus sits in there. It gets thicker and thicker and harder and drier until you suffocate. Or you have to beat the kid on their back to try to get the goo out of their lungs. It affects those channels in other organs too. In the gallbladder, there's a problem with concentration of bile. A lot of other signs and symptoms too. but the one that's most commonly recognized is this lung problem where the lungs fill up with hard, thick mucus. Cystic fibrosis transporter defect. The mucus is thick and dehydrated. It doesn't have enough water in it, so it can't move out. And so it's kind of like having a smoker's cough as a kid. Bacterial infection can get in there because the mucus sits there long enough, it doesn't move it out. Inflammation, bronchiectasis, damage to the bronchi so that they stretch out. And sudden infant death syndrome is an unexplained stopping of breathing in kids. Interestingly, it doesn't happen as much during the first couple of months as it does for the next 3 or 4 months. 3 to 4 months is when it is the most common for it to happen. By then, you think your kid is fine. There's no reason why they would stop breathing. But baby monitors are used now so much to make sure that you know if anything is going wrong. It's more common in males. There is a response in your lungs. There are stretch receptors in your lungs. And when you breathe in suddenly, there is an inhibitory response to prevent you from breathing in more. You know, after you breathe in, you're supposed to breathe out, not breathe in more. So momentarily, you're inhibited from breathing in more. Well, it could be that babies, that's undeveloped and unregulated as well, and they breathe in, especially if they take a deep gasping breath, and it may shut it off so they don't breathe in again for too long. And they just, it turns off their breathe-in signal. Now that's, some people postulate that's what it is. It's not, again, it's unexplained. That's why it doesn't get a name other than, you know, sudden infant death. That finishes the pulmonary section. On to the next.